For this video analysis project, my name is Haley and my partner is Katie, and we did it on a 59-year-old female who was admitted on September 28th due to complications with liver cirrhosis. Some history on this patient is that she had alcohol cirrhosis, breast cancer, coronary artery disease, depression, hepatitis C, PTSD, Epstein-Barr syndrome, type 2 diabetes, chest pain, GERD, hypertension, hyperlipidemia, internal hemorrhoids, and migraines. Allergies are Ambien due to hallucinations, atorvastatin due to liver disease, Benadryl due to restless leg, Lunesta due to hallucinations, penicillin due to hives, and Zoloft due to weakness. This patient has severe ascites and is complaining of abdominal pain. From doing my assessment, her abdomen was tender to the touch. The patient was jaundiced with swelling and edema. The patient was connected to telemetry and was on a cardiac diet. She was scheduled to have a paracentesis and a stress test due to increased chest pain. The patient was using the restroom frequently due to her medications. Some background: what is liver cirrhosis? Liver cirrhosis is scarring that damages the liver and leads to liver failure. The most common cause is alcoholism, excessive drinking, hepatitis B, C, and fatty liver disease. In her case, it was due to hepatitis C and alcoholism from excessive drinking. Hepatitis C is causes that damage the liver by contaminated blood from an infected person. You can get this by sharing needles from someone diagnosed with this. Medication she was on was rifaximin, 550 milligrams, doxycycline due to cellulitis on her hand that was being treated, furosemide, insulin, midodrine, Bactrim cream, and potassium chloride. She was a full code. Going through her vitals, her blood pressure was 102/66, her heart rate was 71, respiration 16, temperature is 98.5, her pulse ox was 98, and then some more about her signs and symptoms during the assessment. During my assessment, I found that she was very jaundiced. She had a large abdomen and was very weak. She had no appetite to eat her breakfast, but needed to eat due to getting her insulin injection. I also found that she had a large amount of edema on her legs and her arms, and there were large bruises all over her body. The patient also had all of the key signs of having liver cirrhosis. Some interventions were furosemide to reduce the fluid and edema. She was scheduled to get a paracentesis, which is a procedure to reduce the fluid. Rifaximin is used to slow the hepatic encephalopathy, and she called that her brain pill. Midodrine is used for hypotension. Diet: she was on a low sodium diet and she was not allowed to drink any alcohol. And then Katie will take over on the education portion.
Now getting into the education portion and also recapping what Haley already covered. Liver cirrhosis is a condition characterized by the scarring of the liver. This can lead to impaired liver function. Other side effects that include fatigue, loss of appetite, weight loss, and nausea. It also has several causes, which our patient had very prevalent in, which hers were hepatitis, type 2 diabetes, excessive alcohol consumption. Others that are included are autoimmune disorders, non-alcoholic fatty liver disease, and heart failure. The diet that you should be intaking when diagnosed with this disease is to make sure that you are having plenty of calories in your everyday diet and to also be having high quality protein. You also need to be limiting your unhealthy fats, alcohol, raw meats and seafood, and also high sodium or processed foods. The scholarly article that Haley and I chose was titled "Alcohol as a Risk Factor for Liver Cirrhosis, a Systematic Review and Meta-Analysis." Alcohol changes that chemical breakdown that removes the scar tissue within the body. This means that the scar tissue builds up within the liver and that the scar tissue replaces normal healthy cells, meaning that it cannot work properly and can ultimately fail, which leads to later patient death. This is the main established cause of liver cirrhosis, being alcohol. The main point of the article was the influences of mortality and morbidity while addressing the assessments of associations between alcohol intake, risk factors, and ultimately seeing the consumption of alcohol. The article conducted a study about the review of quantifiable information and the risk factors related to 3 different levels of average alcohol intakes. Overall, the findings resulted in the indication and threshold effects that alcohol consumption had a large more impact on mortality of liver disease compared to morbidity, with the same amount of average consumption was related to higher risk of liver cirrhosis in women versus men. Concluding that the endpoint was important for the study, this resulted for the implication not only for the studies which burden the disease but then attribute to alcohol consumption is the estimated point. Overall, for patient teaching, when diagnosed with liver cirrhosis, the number one thing to maintain within your lifestyle for that you can control being modifiable is your diet. So providing that patient education about dieting and exercise habits will help with liver function and the recovery process, as stopping the drinking from alcohol consumption ultimately can prevent further damage and significantly increase your life expectancy. Thank you.